The secret to generating passive income for your medical practice has been hiding in plain sight. Today we're going to uncover the secret they hope you'll never figure out. First, a little background. The Center for Medicare and Medicaid Services, or CMS, has said that they want to shift the reimbursement model of paying medical professionals. Many of you know if you provide services to patients, then you get compensated for the work you do. This model, or fee for service, is and it has been the way most doctors and medical professionals have been paid since 1966, with the introduction of the American Medical Association's current procedural terminology codes, also known as CPT codes. This standardized coding system for medical services and procedures is essential for ensuring that healthcare data is captured accurately and consistently, and that health claims are processed properly for Medicare, Medicaid, and other health insurers. While great in keeping accurate account of what procedures a doctor delivers, this system is not great in producing better health outcomes, and at times has and can be abused. Over the years, CMS has introduced a new term, value-based care. Value-based care is CMS's attempt to move toward a compensation model based on outcomes. Did the patient get better because of the doctor's work? This value-based model looks at quality measures to determine how things are progressing. These measures are things that have been proven to work in improving a person's health, like A1C and blood pressure measurement decreases, or typical preventative measures like yearly flu vaccinations. CMS has explicitly said they want 100% of Medicare practices in some type of value-based care arrangement by 2030. This hard push toward a new model by CMS is a medical practice's dream. CMS has created CPT codes that are incentivizing practices to move in this direction. Even better, CMS allows practices to outsource some of the work to third parties to help medical practices scale. Today, I will briefly go over 3 types of CPT codes your practice can utilize to generate passive income. If you like this content and want me to go over more, let me know in the comments below. The first one is chronic care management, or CCM. CCM allows a practice to manage a patient with 2 or more chronic conditions. For example, diabetes, hypertension, COPD. The purpose is to guide patients in the management of their chronic condition. This will be based on health goals and time spent with the patient while coordinating their care. This time with the patient can include monthly reviews, telephone calls, referrals, prescription refills, scheduled appointments, and interactions with other providers. There are several versions of what can be delivered here, but let's stay in the passive income lane. If your clinical staff or an outsourced partner consistently delivers monthly 20 minutes in the coordination of the care for your patients in this program, you will be able to bill code 99490 and see a payment of around $62 per month per patient, which is the national average. Again, this can be outsourced to a third party who should have the staff to meet this requirement. Next up are the remote patient monitoring codes, or RPM. These codes are different in that they are focused on measuring a patient's bioreadings like blood pressure, weight, and glucose. These codes require some sort of measuring device that the patient can use at home remotely, and some sort of secure cloud-based system that collects readings for medical staff to view. There are 3 codes that are important here. For example, CPT 99453, which is the initial setup and education of the patient. This code pays a national average of $20 one time. Next code, 99454, which is a recording of the data from the device, is a monthly billing code for daily device use. The patient must take 16 daily device readings per calendar month, and it can only be billed one time no matter how many devices that patient uses. However, you can total the readings for multiple devices to add up to your 16 daily readings. The national average reimbursement is around $56. In addition to these device-based codes, there are time-based codes for RPM. CPT code 99457 will allow you to bill for 20 minutes for non-face-to-face interactions. These can include daily monitoring, telephone calls, referrals, and prescription refills. The national average reimbursement is around $52 and can be outsourced to a third party, very similar to CCM. Finally, there is an add-on code 99458 for an additional 20 minutes of time that can be billed as many times as you want. This national average is $40. Finally, new for 2023, we have remote therapeutic monitoring codes, or RTM. These new codes verify patient adherence to physical therapy or respiratory medications. In this case, think inhalers for patients that suffer from COPD. The goal of the program is to track usage remotely, track how a patient feels after, track medication, and understand how medications are working. There are currently 4 codes that act very similar to the RPM codes I just explained. They are 98975, which is the initial setup and education and is billable at $17.35 national average. 98976, which is the collection of data over 16 calendar days and is billable at $55.72 national average. And finally, 98980 and 98981, which are payable at $50 for 20 minutes and $40 for each additional 20-minute increment. And new for 2023, this service can also be outsourced to a third party. Now, to bring this home, these codes can be outsourced, and although you have ultimate responsibility as a provider for your patients, neither you nor your staff need to be engaged in the daily monitoring and time-based codes. Let a reputable third party handle this for you. These codes can be stacked together, RPM with CCM or RTM with CCM. Finally, for an average practice looking to implement these codes, let's do an example. Let's say you have 350 patients that qualify for RPM and CCM and 350 more that qualify for RTM and CCM. And your third-party partner who will deliver the time-based codes will be spending 40 minutes per month with each of your patients. So for example, RPM with CCM, that's roughly about $150 per patient per month on average, or $52,500 per month. For RTM plus CCM, that's $160 per patient per month on average, or $56,000 per month. This is an extra $108,500 in passive income generated. So the secret to generating passive income in your medical practice is to utilize CCM, RPM, and RTM codes. And more specifically, work with a third-party provider to manage your requirements so your passive income can truly be passive. If you'd like to learn more about how your practice can make more money, subscribe to our channel and be sure to follow us on social media.